I'm Dr. Shail Patel here at the Ware Centre of Dental Excellence. I'm one of the cosmetic dentists, and I'm here to sort of help talk about one of our dominated topics. So composite bonding is when we apply a tooth-coloured resin material to the surfaces of the teeth. It's a great way to slightly alter or change the shapes of teeth. We can close up gaps, and we can even change the colour of teeth as well. The process itself is very simple, very easy actually itself. It's very important to see our patients obviously regularly for their dental checkups and make sure they qualify for composite bonding. But the process involves taking a colour of the teeth, and then what we do is we try to match that colour with the resin. So we will isolate the teeth either with a rubber sheet or a retractor to pull the cheeks away, so we get a good bond. We then apply the resin to the surface of the teeth. First of all, we isolate them, clean the teeth, and then we put a dental glue to allow the resin to stick. We use a UV light to set it, and then we give it a good polish. And we repeat that for as many teeth as necessary so that the patient's nice and happy after. Composite bonding is a very effective dental treatment to reach and sort of treat a vast variety of patients. Depending on their oral health, so as long as they are fit and healthy, we look at their teeth, their gums and their bite, and as long as everything is favourable and the patient is happy, we can proceed and get a great result at the end of it. There are very few side effects actually with composite bonding, which makes it so popular nowadays. It is still very important to remember that these are very thin coverings that are bonded to the surface of the teeth. So straight after the procedure, it is very important just to be wary and be careful of what you eat. You still can eat normally, but you don't want to be biting in anything too hard. So we usually recommend trying not to eating into an apple, for example. Maybe cut it up and eat it on your back teeth. Try not to use your teeth as a tool, so you don't want to be opening any bags or any containers with them, not that many patients would, but it's very important just to sort of try and be wary and be careful. But apart from that, there are very, very few side effects after. You still want to make sure you're looking after your teeth as you normally would do. Unfortunately, we are all prone to getting tooth decay if we don't keep our teeth clean. So it is very important to make sure that you're cleaning the gums and the margins, and obviously seeing a dentist and a hygienist regularly to make sure that they stay nice and healthy and they last a very long time. So composite bonding is a great cosmetic treatment that offers patients a very affordable and conservative way to improve the look of their teeth. There are lots of dental treatments out there and lots of things that can be done. Some of them can be quite destructive, like crowns and veneers, whereas composite bonding doesn't involve any drilling, any injections. It can be a very conservative way of improving and lifting patient smiles. So as long as the patients want the treatment, most likely they will do. We are happy to sort of provide it. Composite bonding can treat a variety of patients in a variety of cases. There's no age limit actually to composite bonding. So whether you're 9 or 90, it actually works very, very well. We have to sort of still ensure that you're healthy beforehand. So as long as you're, as I said, teeth are healthy, your gums are healthy, and your bite is favourable, we can treat sort of any patients that walk into our door. So after the composite bonding procedure itself, it is very important to note a few things. Because the composite bonding is quite fresh, for the next 48 hours, it's very important not to eat anything or drink anything with a lot of colour. So tea, curry, red wine, coffee, things like that, you just want to avoid for a couple of days because the bonding might stain quite easily. After that, you should be fine and you should be okay to follow normally with your normal diet. You still might find the teeth do stain over time, so you may have to visit your dentist or your hygienist to get them polished regularly. The other things to remember are hygiene as well, which we touched on. It's very important to look after the gums and make sure that they're healthy. And it's also important to make sure, again, we're not eating into anything that might cause them to chip. It is very easy to repair them, but we obviously want to minimize the reasons for returning to see us again.